Hi, my name is Kent. I'm going to be your nurse today. Is it okay if I do a quick head-to-toe assessment on you?
That's fine.
Okay. Can you tell me your first, last name, and date of birth?
Wendy Smythe,
Smythe.
January 9th, 73.
Okay. Well, nice to meet you officially. I'm going to ask you a couple questions here. Um, do you know who the president is?
Yes.
What's his name?
Donald J. Trump.
Okay. Do you know what season it is?
Yes, it is spring,
And what year is it?
2026.
Okay. And what are we doing right now?
An assessment, a
Okay.
medical assessment.
Perfect. Patient is appearing well dressed, well groomed, good hygiene, sitting up straight, comfortable, and no signs of distress. Patient is alert and oriented ×4. Is it okay if I get a set of vitals on you real quick?
Yes.
Okay. Yep, you can just go ahead and relax your arm.
Okay.
You can put it under the table.
Okay.
Yep, right there. Perfect. Okay. 118/76.
I normally am.
All right, I'm just gonna take your pulse real quick. And observe respirations. Okay, heart rate is 70, respirations 18, regular and normal depth. We take O2 saturation as well. Are you experiencing any pain right now?
No.
So, I've got a couple more things for you here. I'm going to have you repeat after me this
Okay.
sentence. Robin Hood stole for good.
Robin Hood stole for good.
Okay. With this sentence and thus our conversation, patient is has very good speech, clear, concise. She's appearing in a good mood and behaving appropriately. So what I'm going to do now is take this stethoscope and listen to your lungs. Is that okay?
Yes.
All right. Take a deep breath in and out through your mouth for me. Good. Again. Okay, I'm going to have you lean forward.
Okay.
Go ahead. Okay. Lung sounds are clear in all lobes. Respirations regular with a normal depth. No accessory muscle use noted. She's symmetrical rise and fall of her chest. Her respirations are also even and unlabored. So now I'm going to listen to your heart. Is that okay?
Yeah.
Listen to it in a couple places here as well. You can breathe normal. This is aortic, pulmonic, second pulmonic, tricuspid, mitral, S1, S2 heard, regular, normal. We would also palpate apical pulse. Is regular. Skin is appearing pink with proper blood flow, warm and moist to the touch. All right. So now what I have you do is squeeze my hands as tight as you can. All right, go ahead and release. 5 out of 5 strength, bilateral upper extremities. Pulses are +2 bilaterally, and capillary refills are less than 3 seconds bilaterally. And I'm gonna have you just extend your foot a little bit. I'm gonna do the same thing down here. I'm gonna feel pedal pulse. It's +2. Can you push down like a pedal and pull back? Perfect. +5 on both. And we're gonna do capillary refill as well. Less than 3 seconds. We do that bilaterally.
Okay.
There's also no edema present on bilateral upper or lower extremities. Okay. So, got a couple more things here. Head, ears, eyes, nose, and throat. So, looking at your face, you have a symmetrical face. No rashes present. We can take a look at your hair here. Thick, evenly distributed. Got a little bit of curls in there too. Those are nice, huh? Head appears symmetrical, normocephalic. Face is symmetrical bilaterally. Facial expressions are appropriate. Could you go ahead and smile for me? Stick your tongue out. Raise your eyebrows. Bite down. Good. Very good. All right. So here, ears here. I'm going to go ahead and take a look with the light into your ear. We're looking for redness and drainage. No redness or drainage present. Ears are properly colored. No wax seen. No trauma. We would look bilaterally. I'm also going to perform a whisper test to test her hearing. So I'm going to whisper something on one side, and I would do this bilaterally on both sides. And I want you to tell me what I whispered to you.
Okay. Acorns are brown.
That's right. Yep. So hearing is intact. So we're going to do the eyes now. We're going to start with this little light, okay? I'm going to shine it right under your eyes. Just look straight at me. Okay. Pupils are equal reactive to light accommodation. Very good. We go ahead and take a look at your conjunctiva and sclera. Conjunctiva are pink and sclera is white. Looks very good. No trauma. Have you had any blurry vision recently?
No.
Or vision changes?
No.
Do you wear glasses or contacts?
Glasses.
Okay. And now we're going to go to the nose. So we're going to take a look at the nose. It is midline and symmetrical. So we do not see any drainage. Could you take a deep breath through your nose for me? So we can hear that there's no congestion or drainage present. Is it okay if I palpate your nose? I'm not going to press too hard.
Yes.
Okay. I'm going to start up top, above your nose. We're going to do all the sinuses. Does that hurt at all?
No.
Okay. No tenderness or pain upon palpation of the sinuses and nose. So, on to the throat and mouth. Just look at me and say, ah.
Ah.
Okay, we're gonna use the light again. Lips and mucosal membrane are pink and intact, moist, no coating. Teeth are intact as well. Okay, perfect. No ulcers present. Gums are intact. Looks good. Do you have any difficulties swallowing,
No.
eating,
No.
drinking?
No.
Okay, that is good. No difficulty with swallowing.
Nope.
So on to the neck now. We're just working our way down.
Okay. It's okay.
So neck is symmetrical and midline, just as the trachea is, as we see here. I'm gonna have you move your head around a little bit. Can you go side to side? Can you go down and up?
Mm-hmm.
Okay. Active range of motion on the neck on all four planes. Trachea, midline. We're gonna look for jugular vein distension.
Okay.
So have you turned to the other side?
The other side? Okay.
Okay. And the other side. As we see, there's no jugular vein distension. And I'm going to go ahead and take a carotid pulse very quickly. Okay. Carotid pulse palpated, regular. Then also we would assess the thyroid. If you could just lift your head up a little bit, you can see that there's no obvious enlargement of the thyroid. And we're going to palpate it lightly, just to make sure that it's non-tender and that there are no nodes. So just keep your head up. Does that hurt at all?
No.
Okay. We could also do a swallow test to see exactly where it is and see the perfect size of it. And then we are going to now verbalize the breast exam. We're not going to actually do it.
Okay.
So we would inspect for chest symmetry, dimpling, flattening, retraction. And then we would also check for tenderness or abnormalities like masses, swelling. And we would do that in multiple positions. So arms at the side, arms overhead, hands against the hips, and leaning forward.
Okay.
On to the gastrointestinal. So, you sit back for me a little bit. Yep, perfect. So we can see stomach is flat, non-distended. Are you having any abdominal pain right now?
No.
Okay. So now we're going to go ahead and take a listen to all four quadrants, listening for vowel sounds. Okay. There are active vowel sounds in all four quadrants. And now we're going to go ahead and palpate for tenderness.
Okay.
So I'm just going to push on your stomach a little bit.
Okay.
Not too hard, okay?
Okay.
So we're going to palpate light. Does that hurt at all?
No.
Okay. And then a little bit deeper. Okay. Any pain?
Nope.
Okay. No pain or tenderness.
Not at all.
No distension. Do you feel nauseous at all?
Nope.
Do you have any vomiting frequently?
No.
Okay. How's your appetite? Do you eat well?
Yes.
Okay, very good.
Little too well.
Little too well. Are you continent of bowel? Do you know when you have to go to the bathroom?
Yes.
Okay. Do you have regular bowel movements?
Yes.
When was the last time that you had a bowel movement?
Probably today.
Okay, that's good. And now on to the genitourinary. So how often do you pee throughout the day?
I don't know, 4 times maybe.
4 times maybe, okay. What color would you say that your urine is? Like clear yellow, yellow, dark?
Yeah, clear yellow, light yellow.
Okay. And your continent of bladder, you know when you have to pee? Okay.
Yes.
Do you drink enough water throughout the day?
Oh, yes.
Good. That's very good. Got to stay hydrated. And we could obtain a urine sample if we wanted, but we are not going to at this time. If she had a catheter, we could assess the output and also the color. So a little bit more here. We are going to assess your tendon reflexes.
Okay.
So we would do this bilaterally. I'm just going to do this on one side.
Okay.
So I want you to just relax your arm.
Okay.
Just like this. We're going to do your bicep reflex. And we're going to just relax completely. Let me hold. It's going to be the tricep here. And then we're going to do the patellar. We're going to do the Achilles.
Okay.
Reflexes are all good. +2. Do that bilaterally. So we looked at the skin a little bit, but we would do a complete skin assessment under all clothing and everything, but we're not going to do that at the moment. Looking for color, temperature, moisture, but your skin was pink, warm, and moist. We'd be looking for injuries, wounds, cuts, scrapes, bruises, pressure injuries, and rashes.
Okay.
And I'm going to go ahead and do a skin turgor. This is just a little pinch here. Okay. Skin turgor is good. That means you are well hydrated. So now I'm going to have you stand up and walk in a circle because we don't have a lot of space here.
Okay.
We would usually walk to a door and back, but the camera doesn't really do us justice.
That's okay.
So you can go ahead and take a seat now. Patient has a normal gait, does not use any mobility or assistive devices. Patient's posture and balance is good upon assessment. Okay. Do you have any questions for me?
Nope, I think that was very thorough.
All right. Thank you very much.